So we've shown some great evidence here, and so what we're excited about is, the first thing as a researcher you'll hear, and Dr. Conrad's online, and I'm going to ask him to speak to this. But if you've treated a cancer in a mouse model and you cured it, the question is, is it idiosyncratic? Is it something just specific to the mouse? We have now treated 3 cold tumors, 3 different cell lines: colorectal, triple negative breast, and melanoma. Now, in a human, triple negative breast is actually immunogenic, but in these cancer models, these are cold. Cold means the immune system doesn't see it, and the implication is that there's not enough message, there's not enough antigen. Antigen equals protein. There's not enough message in that tumor for the immune system to be strongly activated. There may be some activation, but not enough. And so we've shown in these models that when we treat, first we grow the tumors, and then we treat with things that we believe should treat the tumors, like an immune therapy, it doesn't work. Or a control, like sterile water, it doesn't work. But then when we add our targeted hyperthermic therapy, when we actually stress that tumor microenvironment, we see great response. And so we've seen it in these models. And so my thinking, and I'm going to ask Dr. Conrad to comment on this, my thinking is that if you see this across 3 different cancers, and this is 2 different kinds of mouse models, that this intuitively would be translatable to the human situation, or at least more likely to be translatable. Dr. Conrad, I wonder if you can share your thoughts on, am I overreaching here?
No, I think you're making a very logical conclusion. The mouse models, I believe you said, are blacks. Are they, what are the mouse models, the different ones?
Black 6, so that's there's and bulb C. So one is kind of they're 2 different kind of arms of the immune system, as we know it is in immunology.
Yeah, I'm very familiar with these. I worked with these in grad school many years ago. So the Black 6, this is a mouse model that tends to have more of an inflammatory, cell-mediated immune response to fight a cancer, to fight a virus. Valb C is more of a humoral antibody, less inflammatory. So one of the arguments against some mouse model work is that you can pick the mouse strain that tells the story you want to tell. You've picked 2 mouse strains that should tell different stories based on their immune backbone, but they're telling the same story. So I would agree that the fact that you're getting similar results in seemingly immunologically disparate, genetically disparate mouse models is really supportive of this being a generalizable trend, a generalizable mechanism. And having it work so well in multiple different and cold cancer models, I don't know what more you could ask for in a mouse model to suggest to take it to the next level.
Excellent, thank you. Yeah, so that, I mean, this is the excitement, and I'm very fortunate to be at DAL with scientists like Dr. Conrad and other people who have looked at this, and thankfully during our inter-lab and lab meetings and our presentations at rounds, we get the edgy questions that really go to the core of, is this real, and what are we seeing, and what are we missing? So, but we're very excited, and again, this is the stepping stone that made us confident we should be looking at this in the clinical.